Good morning, everyone, and welcome. My name is Sara Agahi, and I'm joined here with Courtney Vesaeur. We are both occupational therapists, registered and licensed. We were educated at the University of St. Augustine, where we received our master's. Yes, same school, same kind of everything. And now we are both certified in lymphatic therapy, and we've been doing that here at Eisenhower for the past 3-4 years. And between myself and Courtney and Danielle, our other therapists here on the main campus, we work to help our patients treat their lymphedema. So today we're going to be talking about lymphedema. What is it? How do I treat it? What are some things that I can do to help manage this condition? So to get us started, I'm going to turn it over to Courtney.
Hi guys, nice to see you. Nice to see you all. So just a brief overall overview of what the lymphatic system is anatomically and physiologically. It is a deep network of superficial and a deep network, of lymphatic vessels, lymph nodes, and lymph fluid. So lymph vessels are both superficial and deep. There's several lymph nodes in your body, and probably upwards of about 600 to 700 lymph nodes in your body. They're all dispersed in different locations, but if you're going to be seeing in your next slide, actually where they are located, they're mainly in the head, in your armpit region, your groin, and in your abdomen. So that's kind of like where mainly all the major lymph nodes are. There are some in the extremities as well. All of those lymph nodes and lymph vessels have lymph fluid in them, and that contains water, waste, debris, minerals, ions, white blood cells that help you fight immunity, those types of things. They have these little macrophages that kind of float around in that lymph fluid and kind of eat away at all the waste and debris. So that's, again, part of your immunity. And that's basically kind of like the basic anatomical and physiological function of the lymphatic system. The next slide here, you're going to see some pictures. On the right side, you're going to see a full body diagram. And like I mentioned in the previous slide, you can kind of see a lot of those lymph nodes in the head. You can see a lot of those lymph nodes right over in the axillary region or the armpits. You also see a bunch down in the inguinal area, which is down by the groin. You see those right in the pelvic region. And a lot of them are in those deep abdomen areas, like the intestines, the vital organs, that sort of thing. On the upper left-hand corner, it gives you kind of like a little bit of a cross section of what it looks like. You can kind of see the muscle is on the bottom with the lymph vessels that are kind of connecting the lymph node system. You see off to the right there, you've got some lymph nodes that are pulling all that fluid from the muscles through the lymph vessels into those nodes. You also have a superficial structure that's you can see the subcutaneous fat there. You can also see the lymphatic vessels that kind of live in the skin. And those are usually the vessels that we actually kind of stimulate with our massage, which we're going to be explaining a little bit later. Below that picture, you see more of an intricate picture of a node and kind of what it looks like. You see kind of those arrows going into the node. So it's taking that lymph fluid into the node, filtering it, cleaning it, and then shooting it out the other side. You see to the right where those arrows are carrying everything out. So that's just a basic anatomical structure of the lymph system. And now Sarah is going to go ahead and talk about what it does.
So Courtney did a great job of introducing the structures of the lymph system, seeing that they're sort of pervasive over the entire body, working to cleanse all of our lymph fluid all the time. And now we're going to talk a little bit about what is it doing? So the lymph system is important in the production of white blood cells. Remember, it's part of our immune system. So those white blood cells are really important for fighting off infection. The lymph system is also working to cleanse and filter that lymphatic fluid, like Courtney was mentioning earlier. It's working to cleanse bacteria, toxins, cellular byproducts, just all of those things that our body needs to remove. We actually speak about the lymph system as our body's recycling center, right? It's working to filter everything, get all of that ick out. Overall, the lymphatic system is also helping to regulate our body fluid levels. We talk a lot about homeostasis and that feeling of balance, and lymphatic system is involved in that, as well as regulating the absorption of fats. That's when we're speaking more about those lymph nodes that are located in the gut, working in the intestines and helping to pull those fats through and get them processed. So these are some images to help depict that a little bit further. On the left, you'll see what I consider to be a little more sophisticated interpretation of how the lymph system is working. The lymph system is working to pull fluid from the tissues, as you can see in that left-hand graphic. And then those green guys that kind of look like spiders, those are supposed to be the lymph nodes, and those are helping to filter that fluid. It's then going to get transferred up into the venous system, an area called the venous angle, and it's going to transfer into our circulation. That circulation is going to then take it to our kidneys. Our kidneys are going to continue this filtering process, and that final byproduct is urine. In the middle is a much more basic interpretation of that. So same kind of idea as what you're seeing on the left, but a little bit more pared down, again, trying to explain that the lymph system is really helping to pull fluid from the periphery tissues. It's helping to cleanse that fluid as much as it can, continue to transfer that filtrate to the circulatory system where it then gets filtered further. And then that final graphic on the right, that's really to show how in parallel the circulatory system and lymphatic system are. You can see that they kind of look similar in the pattern of how they're shaped, where they go, right? So we're seeing that it's sort of that where the cardiovascular system goes, the lymphatic system goes. And what that really means is that one can heavily influence the other, and there's a lot of interplay there. And so how is the lymph system moving that fluid? We keep talking about these nodes and these collectors and pre-collectors and vessels. What is it doing? So internally, meaning within the lymphatic system, it's working to absorb fluid through those lymph capillaries, those pre-collectors and collectors, meaning a smaller vessel to a bigger vessel to a bigger vessel. And there's actual suction of that lymphatic fluid through the lymph node. Remember, that lymph node is that real functional unit of our lymphatic system that is doing the filtering. And the lymph node and lymph vessels actually have their own smooth muscle called lymphangion, and that's what's helping create that motility and motion and fluidity of this fluid. Externally, the lymphatic system is moving lymph fluid in a lot of ways, through breathing, the rise and fall of the diaphragm, through external compression, something I'm really into, wearing something externally to help give support to the tissue and skin so that lymph fluid doesn't even really have a chance to accumulate there. Other ways that lymphatic fluid is externally controlled is through muscular contraction, exercise and movement. We have a heavy focus on that here at Eisenhower, and just in our daily lives as people walking around, moving and having good exercise is helpful and beneficial to our lymphatic system. I'm going to turn it back over to Courtney so we can speak a little bit more specifically about what lymphedema is as a condition.
So, like, what is lymphedema, and, how is it, how do you define it? Well, it's abnormal swelling or edema due to like a compromised lymphatic system. That's the basic way of explaining that. Usually it's typically unilateral. You have it on one side versus the other. It's very uncommon to see it bilateral or exactly the same on both sides. You have two different types. One is primary, and the primary is a genetic. You're born with it. So you either have some kind of damage to the lymphatic system, the structures, a malformation, or an absence of a certain part of the lymphatic system, which causes more swelling than usual. We also, and this is the second part is secondary, which is acquired through a certain effect of life, whether it be surgery, radiation, chemotherapy, a traumatic situation, even infection, reoccurring infection, immobility. Just as Sara had mentioned before, exercise is a big part of our program. Immobility makes you lose that muscle pumping, and that muscle pumping drives that lymphatic system. We also are dealing with people who have chronic venous insufficiency, and that means that their veins are not working well, bringing that fluid up into from their legs up into their trunk. So a lot of the times chronic venous insufficiency can become lymphatic because it puts some sort of stress on the outside tissues that are involved with the venous system. As she mentioned, the circulatory system and the venous system are very close by. They kind of almost overlap with each other. So they're very close with each other, and also can get some type of trauma from that. The most common form actually of lymphedema worldwide, which is an interesting statistics, is actually from a parasite through a vector of a mosquito called filariasis. And this is going to be more in a third world country where these mosquitoes are actually biting these individuals, and it carries a parasite that is processed through the body. Its mature parasite lives in the lymphangins, or the little pumpers that Sara was talking about, and it actually slows down the lymphatic system. It prevents the lymphatic system from moving and from actually being able to filter and to move fluid around. As you can see in this picture here, you have a gentleman here on the, his first picture is his left leg is just almost 3 times the size of his right leg. This is a very typical site of filariasis infection. You can also see that the next picture right next to him is a picture of him after he's gone over 7 months of integrated treatment. This is actually, we got this citation from a clinic in India where they're actually dealing with specifically with patients with filariasis all the time. And they are able to do integrated treatment to be able to bring their swelling down. At this stage, you can actually see this lymphedema is really putting a lot of stress on the skin and the muscles and all of the structures of the leg. So you can see that the damage is possibly already done to that skin, even though his swelling did come down. So moving on to kind of the next slide, which we're talking about the stages of lymphedema, like I had mentioned in the previous slide. Unfortunately, there's no set uniform staging system. There's no standardized staging system for lymphedema. However, this is actually the staging system that we use here in the clinic. So when you come in, get an evaluation from us, we often stage you, and every single time we do a reevaluation, we always stage you to make sure that we know exactly where you are in your management. So the first one is stage zero, which is no evidence of any edema or fibrosis. Fibrosis is a protein-rich fluid or substance that lives interstitially in between the skin and the muscle that is hydrophilic. It loves water. So it actually changes the structure of the skin. So there's no evidence of that in stage one. Or stage zero, excuse me. Stage one, however, you have a little bit of minimal to no edema noted. You still have good skin. There's no problem with any skin problems. There's no discoloration. You might have a little bit of pitting, which means that when you put your finger onto your skin and actually push down gently and then take your finger away, you actually are left with a thumbprint or a fingerprint. At this point, it's considered to be reversible. So we can definitely, if we catch people early enough, we can kind of reverse them and bring them back to stage zero pretty quickly. Stage two is more of a moderate edema. You're dealing with limb swelling that doesn't resolve with any elevation. It might come down a little bit, but it honestly does not come down completely, and it's not going to be back to what it was normally. A lot of the times people in stage two end up experiencing a little bit of pain because of the swelling. Fibrosis is definitely noted here. So and also to let you know, fibrosis has kind of a little bit more of a spectrum. So you actually have at the beginning, when you start getting fibrosis, you have that pitting, that evidence that it's there. But then eventually, as you continue to worsen, that fibrosis can get really hard and indurated. So it's very difficult to move, be able to move your joints and to be able to have any type of like mobility. Your skin often sometimes starts to take a beating at this point because the fibrosis is not allowing the skin to get its normal circulation. You might have, again, the binding definitely keeps those joints from moving the way that they should. At this point, depending upon where you are in this stage, it can possibly be reversed. We don't always like to tell you that it can be reversed, but the thing is it really depends upon your severity. Stage 3 is more of a severe edema, more of an elephantiasis. Definitely like the gentleman that you saw on the previous slide with his leg there on the left. That is considered to be a severe stage 3 edema elephantiasis situation. He has severe hyperkeratosis, which is another scientific term for fibrosis, which is that hardening of the skin, the induration, and basically you're dealing with a lot of skin irregularities. You could deal with wounds, rashes, skin breakdown, anything that kind of just makes it much more difficult for someone to be able to manage. You're dealing with a lot of skin and tissue lobules, things that are kind of hanging down and not being able to be supported by your skin or your muscles at that point. So stage 3 is, we definitely see some stage 3 coming in through our clinic, and we do get them to a manageable state. So there is definitely hope for those stage 3s. So lymphedema can definitely be managed. It's not necessarily something that you have to live with for the rest of your life. The next slide is mainly about the signs and the symptoms of lymphedema. How do I recognize this? I mean, do I have lymphedema? How do I know? Well, first of all, don't worry. Don't try to self-evaluate yourself all the time. What you want to do is just ask simple questions like, you feel a little bit more tight in your limb, in your trunk, or maybe around in your wrist. When you close your hand feels tight. When you try to move your ankle around, it feels really tight. There's also a heaviness that's associated with a limb. Sometimes you're like, gosh, doing this, like reaching up into a cabinet, you really feel how heavy your arm is, or it seems to like it gets extra fatigued quickly. So that's another sign. You might have a new onset of pain, some kind of weird pain that you hadn't experienced before. So that might be another sign as well. A new onset of numbness or tingling, burning, or hypersensitivity on your skin. A lot of the times with swelling, your nerves kind of like start to act out and give you a little bit of tingling and numbness. And sometimes they get hypersensitive. Again, these are very subtle symptoms, but something to just kind of keep an eye out for. Again, you have skin inflammation, and this is also kind of a wide spectrum. The most common inflammation that you're going to see is redness or some kind of like either itchiness or maybe even a skin different, like maybe a drier skin or something that is not typical of your skin personally. A more advanced skin inflammation might be weeping. Weeping is when the skin gets so stretched that it's no longer able to contain any of that fluid that it starts to weep. You can also get hardening or darkening of your skin. That's also the induration. That's the hardening of the tissues. The darkening is the poor circulation that you're not able to get to the skin as well. You also might have a sign of like slow healing wounds. You might have a wound that has been taking an extra long time on that affected limb that is, not able to heal. So those are just some like more of a wide spectrum of skin inflammation. Again, skin with shiny, more stretched appearance, no wrinkles, that sort of thing. That's a very easy one to recognize. Again, that takes me into the absence of wrinkling into that next little bullet point right there. There's a significant increase in girth of the limb. So if you look over to the right at that picture, you can kind of see the difference between the two limbs. There's one limb that's relatively normal, and you see that there is a definite girth size, maybe even a little bit more redness there compared to the other side. So that And the way that I measure this is like if you're putting on a shirt or if you're putting on pants and you notice that one leg is tighter than in those pants or in that shirt, that is normal. Then you know that the girth is going to be a little bit larger than the other side. Um, Obviously, too, you know that you're in one of the stages when your swelling doesn't change with any elevation. So that's a big sign right there. And also recurrent infections, like I had mentioned before, is part of your skin inflammation. But this is something where you might knock yourself against the dishwasher, you might knock yourself against the edge of the bed, and that infection, or that might get an infection that just may never heal. It might get better and then reoccur. So, and then that will take us into the next slide, which we kind of give you an idea of what the staging system looks like. You can see that first stage up in the upper right there with the blue background, that you have a mild stage 1. There's just a little bit of a difference between the two legs. Then you have a little bit more of a moderate stage 1, which you can kind of see that the girth of the thigh is getting a little bit bigger. There's not a lot of space between the knees anymore. You're starting to see a little bit more skin folds around the ankles. And then you move over to your moderate stage 2, you can definitely see there's a lot more skin changes. Your knee is no longer visible. And down below, because you're getting so tight by that foot that they're starting to create new creases because of the pressure of the fluid that's there. And then finally, you have your stage 3, which is more of a, in my opinion, more of a moderate than severe, because usually severe indicates a little bit more like fibrosis, a lot more skin issue, but definitely this could be a severe case because of the edema, because the edema is so large and the leg is so large around the knee and around the calf and all the way down into the foot. And again, we do see people here at Eisenhower in that stage 3. Over to the left, you'll see a gentleman that has got basically bilateral swelling. He's kind of a stage 2, stage 3. He's got skin irregularities. He's got hyperpigmentation, which is a little bit more redness in that skin tissue. You can definitely tell that he has a lot of problems with his nail beds, his toes, a lot of hard time keeping that nice and clean. And those are usually issues that we have to deal with someone in stage 2 and stage 3. We have this lady here who is pictured with a very large arm on the left and a relatively normal arm on the right. This is a typical stage 2, stage 3 arm. She's got hyperkeratosis or fibrotic arm. It looks very dense, like the tissue is very dense there. You can see a little bit of discoloration in her skin. We have seen people like this in the office, in our clinic, and we've had great success in bringing down their swelling and actually getting them back to the things that they love to do. So there is definitely hope for people who definitely have swelling of this size and of this severity. We definitely are able to work for you and be able to help you get back to normal.
And just to sort of continue the conversation on signs and symptoms of lymphedema and what that might look like, this specific slide is more related to venous disease that can turn into lymphedema or a lymphatic condition. So this is just to show the progression of that. You can see in the first image there, normal looking legs. And as we move to the right, you see the progression of the veins changing, you see them becoming more visible, larger. A lot of that has to do with stretching of the vein walls and those becoming less efficient in pumping. Swelling and skin changes, like Courtney had mentioned before, right? Seeing some of that redness, that increase in girth. And then the final stages being venous ulcers. That fluid just tries to find any means necessary to escape. And unfortunately, that can result in ulcers, and something we work with all the time, something we can help, something we can reverse, something that can be improved with lymphatic therapy and management. So let's talk a little bit about what are the solutions and interventions for this. We've already discussed so much about how the lymph system works, what the anatomy and physiology is, what lymphedema looks like, how it can be either genetic or an acquired condition. So now we're going to touch more on how do we treat it? How do we manage it? How do we reduce girth? How do we reduce pain? How do we reduce that inflammation? So really a hallmark of what we do as lymphatic therapists is manual lymphatic drainage. And we're going to be going into that a little further later on in the presentation. Exercise and stretching, right? That importance of muscle pumping, muscle mobility. Compression garments and compression pumps are examples of that external influence on the lymphatic system. So working with long-term garments, working with a machine that might replace your lymphatic therapist for your long-term management. Skin and nail care, very important, like we saw in those previous slides. So many skin changes that are associated with lymphedema as a condition. And our skin is that foundational barrier that protects us from everything outside of us. So it's very important that we have a focus on what's happening at that level as well. Other interventions that are indicated for lymphedema, there are surgical treatments that are currently happening that are indicated for those with lymphedema. I encourage you to do some searching. Mayo Clinic is doing some really interesting things if you're interested in learning about that. Nutrition and hydration, very important as components to lymphatic management. What we eat affects our swelling. What we drink and our ability to stay really hydrated affects that ability of that fluid to freely move through our body. So very important that we have a focus on that as well. And then there are also modalities that can help with lymphedema. As previously mentioned, lymphedema can be accompanied with a lot of pain. And so there are modalities that are used for that. And lymphatic treatment can be both relaxing and stress relieving. So we're going to go a little bit more specifically into our program here at Eisenhower Health, our day in, day out, what we're trudging in and out doing all the time and loving. So we have a real focus at Eisenhower Health on 5 main parts of what lymphatic management is. So the first, again, being that manual lymphatic drainage. The second being the ever so important exercise and movement. The third being compression garments. And please let it be known, like, this is not just your grandfather's knee highs. Like, there are so many other types of compression out there, so many other ways to support your skin and tissue that's comfortable and effective. Another big component of our lymph program is a focus on nutrition and wellness. Again, that hydration, education in how you keep this managed and prevented for life. And then the big, the final tenet of our program is what we're really here for, which is teaching our patients lifelong lymphatic management. We are about helping you to help yourself, continue to manage and keep things under control. So very large focus on that with our program at Eisenhower Health. So we're going to go a little more specifically into what we actually mean by that. So this hallmark of treatment for us, the manual lymphatic drainage, this involves stimulation of both the superficial and deep lymph node groups. So some of our patients out there in the audience, you already know this routine. This should sound familiar to you. Manual lymphatic drainage also involves a really gentle massage. We explained that we're really focused on creating a skin stretch. And the purpose of that is we're trying to mimic that lymphatic pumping that the lymph system isn't necessarily doing as efficiently for itself. We're focused on a stretch of the skin, creating that lymphatic pump, and we follow a really specific pattern. We work from the center of the body, we work out to the extremities and limbs, and then we work our way back. And this has a specific purpose. We're really trying to mimic how the lymphatic system flows and promote drainage of that lymph fluid. Overall, the purpose of manual lymphatic drainage, again, is increasing how much that fluid is moving through your system, how fast it's moving through your system, It has a specific focus in pain reduction. We also use it with some of our post-surgical patients when we talk about rerouting, using manual lymphatic drainage as a means to create new lymphatic pathways. And so I'm going to touch on that actually in our next slide, so you have a visual on what I mean by that. So this is just an image to depict some lymphatic drainage patterns. You can see that this person is fairly divided bilaterally, and that's to depict that we have watersheds in our body, these natural sort of meridians that our lymphatic system is originated against. So this is to show how that fluid moves. This is to show maybe a more basic version of how we might massage. So you can see up at the shoulder there, those arrows pointing toward the armpit. That's because we're trying to always work that fluid toward a lymph node group. And so we use these types of images also to help with patient education and learning. And lymphatic drainage patterns are primarily used to move fluid from areas where there might be a lot of buildup to areas where there are good, healthy lymph nodes to process that fluid. I'm going to turn it back over to my colleague, Courtney, which she'll talk about one of her favorite topics.
So yes, exercise is key. This is one of my favorite topics. I absolutely am such an advocate of trying to establish a good exercise program. And not only is it just good to have a good exercise program every day on a regular basis, even if you don't have lymphedema, but also it's especially important when you have lymphedema to be able to get that muscular pumping back. You want to make sure that you know that muscular pumping drives the lymphatic system. And especially if you're using compression as an external force, that muscular pumping is pumping against that excess, that outside force, which again helps with fluid mobilization. So it works in tandem with all the other types of parts of our program, like compression. Another thing is you got to stretch and you got to strengthen. A lot of our patients, we see a huge chemotherapy, radiation, cancer-based population, and a lot of them are weak when they come to see us, and they have a hard time moving after a lot of their treatments. So we really are advocates of stretching the body out, strengthening the body. You have to understand too that these people are in a very deconditioned state a lot of the time. So we really try to pace our patients. We want to make sure things are easy and attainable goals for them. We're not going to just tell you to, here, go out and run a marathon and come back and check with me in a week. No, that's not what we're saying. What we want to do is we want to make this exercise program tailored to you so that way you're able to fit it in with your daily life and not feel like you're exercising all the time. You're doing the effective exercises that are helping move your lymphatic system, as well as stretching and strengthening. Another great proponent of exercise is cardiac exercise. We need to get that muscle pumping. We need to get that heart pumping. And as we saw in previous slides, you know, that circulatory system is really close to the lymphatic system. So once we get that cardiac system going, it also helps with, you know, your lymphatic system. And it just goes back to everybody has always said that with increased exercise increases your immunity because it increases your lymphatic flow. So then we also have as a final point, just the importance of having a consistent routine. So, you know, the consistency is the important thing. We are talking about the overall routine. If you miss one day a week, just get right back on the horse again and keep on going. Try not to get so in your head about, oh my gosh, I needed to do it 5 times this week. That's not the goal. The goal is consistency. So this just shows a different gamut of all different types of pictures of people doing yoga, doing resistance training to help with their strengthening, a little bit of walking, hiking. And we always are promoting people using hiking sticks to kind of help them. It helps with an upper body motion when they're hiking as well as a lower body motion. You see in that upper left-hand corner is like, that's water aerobics. That is a perfect exercise. The reason why we promote being in the water so much with people who have excess swelling is that the hydrostatic pressure of the pool acts like compression. So it actually helps you get rid of a lot more fluid in the water than you would on land. And so just to kind of give you a little bit of examples of, that's probably the most beneficial exercise. And then of course, in the right-hand corner, you see everybody doing yoga. And I just wanted to tell you that don't think that you have to do those particular yoga poses. We have a chair yoga program that we can give you. There's a lot of different easy yoga poses that can attain the same type of benefits as you see in those pictures. So exercise is wonderful, and I will do everything, and Sarah and I will do everything in our power to make sure that we have a doable exercise program for you.
And so another hallmark of our treatment program here at Eisenhower, one of my personal favorites and one I get really into, are compression garments, right? It's like, we're living our lives out during the day. Gravity has an influence on us all the time. We got to support that tissue. We got to help give it that external compression. So like I mentioned before, that doesn't just mean compression stockings. That doesn't just mean compression sleeves, those very traditional things that you think of when you think about compression garments. So we actually work with bandaging, we work with inelastic compression, elastic, flat knit, we do elastic taping, which is a really wonderful option for our patients in the summer. And I'm going to click to the next slide so I can show you some more specific depictions of that and we can explain it further. So up in the left-hand corner, you'll see what is considered, again, to be a gold standard treatment. This is bandaging. This is a multi-layer bandaging system. So you can see they're wrapped not only from they're wrapped from their digits all the way up to their axilla, their armpit, in a spica pattern. And that's with the intention of really helping to mobilize that fluid with consistent gradient compression. This person probably also has some skin changes like we had mentioned before, maybe some of that hardness, some of that indurated tissue. Bandaging is that first method of treatment to really get that limb down. Now, sometimes we have to use that, and sometimes we can get away with something a little different, like what you see over to the right there in the top corner. So those are examples of what we call inelastic compression garments. In meaning not elastic, meaning no stretch. They use Velcro and they are actually meant to mimic the same effects of bandaging. So this is a garment that's really indicated for an independent user, someone who's trying to manage their manage their lymphedema at home independently. It's also a really wonderful garment to use as a caregiver or as a spouse who is helping a person with lymphedema. As you can imagine, doing multi-layer bandaging on your loved one, that could take, 20, 30 minutes. Putting on an inelastic Velcro compression garment on your loved one, I think we can get you down to about 5 minutes, depending on how many pieces there are. So there's a lot of really wonderful functional uses with these inelastic products. And the girls and I at the clinic, we use these with at least probably about 50% of our patients. Yes. In the lower left-hand corner, you will see some examples of what we consider elastic compression garments. So those are garments that do have stretch to them. These are more indicated for those stage 0, stage 1, maybe really early stage 2 type patients. So this is compression that has a thinner wall. It doesn't have quite as much containment, but as you can see in comparison, much more flexible, softer, a little bit more mobile. So these types of garments can be used either as a beginning, phase for someone, or these might even be more of a transition type of garment. Maybe they've already gone through the bandaging and the inelastic, and now they're transitioning to an elastic garment. In our clinic, we also work with custom compression. That's another area that is flat knit garments, a little bit more containing, and those are for our patients who have more specific needs, maybe areas where they have more fibrosis in one place than another, and they need a sleeve that helps control for that. So we do work with custom measuring and flat knit garments in our clinic. And just to address that final form of compression that we have depicted here, that's a version of elastic taping. And this is a really fun treatment that we use a lot in our clinic. This is a nice treatment to use in the summer here in the desert when we're hot and don't want to wear extra compression. This is a nice way to get some support and stretch on the skin. And then we also really encourage you to really do a lot of lymphatic muscle pumping with that to get the most benefit. So those are just some examples of compression, just to kind of give you an idea that there are other things out there besides what you think of traditionally. There are other options out there that we'd love to show you and love to expose you to. Another component of our program here is we do just have a focus on nutrition and hydration. Very basically, it's important that we encourage our patients to have good daily water intake. Current recommendations from Mayo Clinic are about 3.7 liters for men, 2.7 for women. That's a decent amount of water. You can imagine that you might even increase that a little based on the fact that we live here in the desert and it's so dry. Currently, there isn't a specific diet recommended for lymphedema, but what is recommended overall is one that is high in fiber, high in protein, fruits and veggies, lower in fat, and definitely lower in salt, right? That salt sort of promotes swelling. We are not nutritionists or dietitians, and so if any of this sounds like something you are interested in, if you're identifying some of these signs and symptoms and you'd like to explore nutrition a little further, we really want to recommend that you reach out to your doctor, explain what you're noticing, and have them set up a referral. In fact, Eisenhower has nutritionists and dietitians on staff, and so that might be an option for you.
So as Sarah had touched on before, kind of our ultimate goal, in the clinic is to help you with your lifelong management, because you're going to be dealing with this for the rest of your life. But again, it's manageable. So you're not going to be in that current state forever. And we're going to go into the phases of a treatment into the next slide. But this is just to let you know that it's the importance of establishing a long-term routine. And this long-term routine may change kind of like as you kind of get more and more managed. So it just depends. It's different for everyone. You're going to be customizing your routine to yourself. You're going to be modifying and changing it whenever you need to. As OTs, we are doing activity analysis all the time. So we're constantly trying to figure out what type of activities that you like to do at home, and can we help with that? Can we help you do that more independently? And so that's also part of establishing that long-term routine. Sometimes people are very compromised in their, and they do need to have some caregiver training, whether this be an actual caregiver that comes into your home privately or through a service, or if it's actually a spouse or a family member. Sometimes that caregiver training is available for them to come in and get trained. We are happy to show them how to put on compression, take it off, or donning and doffing, the way that we like to say in OT. We also show them how to do an MLD, show them how to do a manual lymphatic drainage massage. We show them how to reroute. We show them how to take care of their loved one to be able to make sure that they're dealing with any excess swelling. We also make sure that we promote skin care. Sometimes people have back problems and they can't get down to take care of their toes, and they need to have someone help with that. So that is another thing too, because obviously if you get any type of sores on that affected side, you are risking infection. So you want to make sure that you have really good skin care and hygiene. You can see in this picture, this is a picture that we absolutely loved. When we saw it, we were like, okay, we have to show this one, because it actually shows two different types of donning mechanisms. This person is donning on, it looks like a knee high, and you can see that little that little green toe. That's actually a sleeve. It's a donning mechanism called an easy slide. So you slide that on the leg first, and then you pull the garment over the top of that. And then you're able to pull that easy slide out from the toe, and it leaves the stocking on. So it's kind of a cool little unit. We use that a lot in the clinic. We use it also for arms, not just legs, but you also see this caregiver using plastic gloves or rubber gloves. We also use those to save our hands because sometimes people's arthritis flares up or they're constantly donning gloves and it's really tough on their hands. Using some kind of like rubber gloves, surgical gloves, donning gloves help kind of get a little bit better grip to pull up that compression garment. And as I had mentioned, we're going to go ahead and go into the phases of treatment, and I'm going to turn it back over to Miss Sara.
So we talked about the program at Eisenhower and what we do, and now this is something more specific just to speak to the phases of that program. And keep in mind that lymphedema is a very fluctuating condition, so it's not abnormal that you might kind of go in and out of these phases within a course of treatment. So the first phase is that acute phase, right? You're coming into the clinic, you've got increased swelling in a limb or somewhere else. And at that point, we're really focused on reducing that girth. We're focused on drainage. We're looking at the skin. We're assessing for any wounds, skin breakdown, changes that need to be remedied. And the amount of time a patient spends in this phase is varied based on how severe the swelling is to begin with, right? The intervention phase is really related to all of those solutions and interventions we were speaking to earlier. So this is establishing and getting into that daily exercise routine. At this point, we're still seeing some reduction in girth. We might see some fluctuations in girth at that point because this is when we're trying to get our patients into compression garments. This is when you're learning how to don, when to don, how long to wear it, where to wear it, what situations, all of this. And as you can imagine, there are fluctuations within that. Pain management modalities are being used at this time if they're necessary or needed. Caregiver training is getting completed during this time. Do we need a spouse to come in and learn how to do taping on your leg? Do we need a spouse to come in and learn how to do some lymphatic opening on your back in the places that are not so easy to reach? This is where we're focusing on that. And we're also focused heavily on lymphatic massage, the actual mobilization, drainage, movement of that lymph fluid. The final phase is again, kind of getting back to that lifelong management is really important, the management phase. This is where we're expecting our patient to be able to demonstrate their exercise program. We're expecting them or a caregiver to be able to show us how they use their compression garments, get them off and on. At this point, the girth is fairly stable and we're kind of working with our end results. We might be working on getting a compression pump figured out so that you have a great long-term management routine there. And this is also a time where we really want to make sure our patients are fully honed in and remembering what the precautions and contraindications are when you have lymphedema, those things that you need to be careful of avoiding. And so we make sure that those are clear and cognizant in their mind and that they're ready to more or less graduate from us. And so that's the importance of the management phase.
So just to kind of touch on briefly about other conditions that lymphatic treatment can help. And it's not just for, just for lymphedema. You can actually have people who have neurological swelling, like from Parkinson's or stroke. As you know, Parkinson's deals with immobility. So they're losing that muscle pump. So it might actually help with reducing some of their swelling. Rheumatoid arthritis, osteoarthritis, it usually helps with pain and swelling. Chronic pain, it's always nice because it gives kind of a little bit more of a stress relief, not necessarily something that we actually treat on its own. It's usually something that's actually in tandem with lymphedema. So that's usually how we see it in the clinic. As mentioned before, venous insufficiency and stasis, we do see that in the clinic quite a little bit, or quite a lot. Autoimmune disorders, again, RA is autoimmune, so we definitely see some people with some swelling and pain there. As a full aesthetic treatment or body detoxification, even if you don't have any lymphatic issue, it still serves as a detoxification. That's not something that we do here at our clinic, but it's definitely something that's done in the private sector. So it might be something that you might want to look into there. Definitely with post-surgical healing, we definitely have had a couple of patients that have a hard time getting rid of their swelling post-surgically. So we do see those people in the clinic, as well as wound closures. Sometimes those long, slow healing wounds just do not close. But what that lymphatic treatment does is it increases that immunity, increases the lymphatic system, and it actually helps with wound closure. As I mentioned before, kind of more from an aesthetic treatment, or maybe even a chronic pain aspect, stress management and wellness. That's also what a lymphatic treatment can do. Again, not necessarily something that we do only in the clinic. That's more in the private sector, because stress management and wellness is something that we deal with all the time. So, and we also have the fibromyalgia, which is also considered to be an autoimmune disorder that is dealing again with chronic pain and sometimes with swelling and hypersensitivity. So sometimes we see that in the clinic and sometimes we don't. It also can help with dermatological conditions like acne, scars, any skin irregularities, that sort of thing. Again, something that we also see in tandem with lymphedema, not just by itself. So those are just some other conditions that lymphatic treatment can help. And now what we're going to do is we're going to kind of show you a little demonstration as to what we do to kind of stimulate the lymphatic system. But Sarah's going to kind of explain the first part of this, and then I'm going to help her with the second part.
So yes, what we wanted to do today is just give you a little something to take with you, something that's helpful for anyone with a lymphatic system, which should be everyone here. So we're going to focus specifically on deep belly breathing, but I just wanted to mention that typically our daily lymphatic health routine would include stimulation of the node groups, but because we don't fully know our audience and population that we're speaking to, we're just going to use that more from an educational purpose. So I will have Courtney demonstrate that and walk us through that, but then we're going to focus on the deep barrel breathing as a final component. We're just going to walk you through a very basic little routine here. Again, this is something that we're just going to have Courtney demonstrate for us. And then for the deep breathing exercise, we're really going to encourage everyone to join us for that. So this first part here, this is just a very basic routine for stimulating the lymph system. So we're going to start at...
So let me just take off my
Let her take off her lab coat.
I'm going to strip down.
And maybe her scarf so you can see her neck.
Yes, here. Sorry about that, guys.
Okay, so she's just going to show us the very basics of a very simple lymphatic routine. So she's going to start with 2 fingers right there at the top of the sternum. That's where we have a lot of great cervical lymph nodes, a lot of lymph node activity there. She's doing a firm motion circularly, and she's doing about 5 to 10 reps there. For some of you, this might look very familiar. The next area she's going to focus on is above the clavicles in that supraclavicular region. A lot of lymph nodes housed there. She's doing just a very gentle skin drag, trying to promote motility and motion of that lymphatic fluid, trying to promote a movement from the outer to the center for better processing of that fluid. Then she's going to come back to that notch above the sternum, and she's going to do her little circles in a firm motion. So this again is helping to stimulate the cervical lymph nodes. The next area she's going to focus on are the axillae, fancy word for armpits. So she's going to get right into that. There you go. I see some people joining us.
Right on.
Awesome. She's going to get right into that armpit and really work that area. She's using firm pressure. She's doing it bilaterally, right? Our lymph system is on every surface of the body bilaterally. We want to work it all. So this is helping to really drain the arms. The next area she's going to focus on is the groin, what we like to call the anatomical panty line. Oop, having to get on her tippy toes there.
There we go. Oh wait, I'll come a little closer.
And
there we go. So right in here.
She is working on stimulating from the outer hip all the way in. She's trying to get as much surface area as possible, right? Remembering that the lymph nodes are all through that area. So the more that we can touch and stimulate, the better. And she's working her way out. Okay. So that is just a basic rundown of the superficial lymph node stimulation. For this next portion, we'd really like to invite all of our participants here today to join us. This is a wonderful exercise, not only for lymphatic health, but also stress management. This is good for cleansing the mind as well as cleansing your body. So we're gonna focus on a deep belly breath. Courtney's turned to the side here so you can see her abdomen rise and fall. She's going to put her hands on her abdomen and let that abdomen rise and fall. So we're going to take a deep breath in through the nose, let that abdomen rise, and then breathe out through the mouth, pushing that air all the way out, trying to draw that belly button back to your spine. She's breathing in, making her belly full, and then she's pushing all the air back out, trying to create that lymphatic pump, helping to stimulate those deep abdominal lymph nodes. Can everyone see that? Now she's moving back and forth. And then have her do it one more time so you can see. She's doing a deep breath, in, deep breath, making that abdomen rise and pushing all the air back out through her mouth and letting that abdomen fall with a nice little core tightening at the end. So we want to encourage you. That's something that you can do throughout the day, during the day, helping to improve your lymphatic health, helping to improve pumping. And now we're actually going to turn it over to our question and answer portion. And Courtney will be taking our first question.
I've got one over here. I was asked to ask the question. They notice swelling happens when they fly or if they take a trip up to the mountains. Does that mean that they should look into getting lymphedema therapy or looking into it?
That's actually a really good question, because that's something that I noticed about myself. I don't necessarily have lymphedema, but I do notice that when I go to elevation, that I swell a little bit more in my limbs. I swell in my ankles or maybe like kind of up my leg a little bit. And that's one of the, that's just because of the pressure change. And that's one of the atmospheric pressure change. And so what happens is when we go up in flight, the pressure is less. As we go down down to sea level, the pressure becomes more. You actually have more gravitational pressure. So when you're going up in elevation, like flying, going up to the mountains or anything like that, you're gonna, the body doesn't have as much pressure on it. So that way it allows it to swell. So for example, like for me, I actually wear compression stockings when I go on a flight, just because I think it's, I have a hard time taking off my shoes and then putting on my shoes at the end of the flight because they won't fit in the shoe. So basically I'm like, okay, well, I need to wear some compression stockings. But I have noticed that over the years, it has not gotten worse. So that's another thing that you have to think about too. Has it worsened over time? A lot of the times people get it, in their mid 30s and they continue getting that for the rest of their lives. But there's other people that start to get it in their 30s and they start to worsen by the time they get to their 50s. So those are the type of trends that you need to kind of look at. You need to see, is it worsening? Are you having a hard time keeping your swelling down? Is it not resolving with elevation? Is your tissue changing? So all those signs and symptoms that we went over before, you kind of have to think about and kind of keep in the back of your mind.
Great, thank you. Mary Peters has a question. She would like to know, does Medicare cover compression garments, pumps, or other parts of treatment for lymphedema as a result of breast cancer?
Okay. I'll take that next question. Sorry, we're doing a kind of interesting little rotating thing here. So the question was about, does Medicare cover compression garments, correct? Okay. So Medicare does not cover compression garments. Medicare is really wonderful about covering your therapy. They give you a specific bank of monies every year that then your therapist draws upon for your visits. And so as far as what Medicare does cover is they have specific recommendations. They will cover a garment if you show persistent wounds for 6 months. So there are a lot of hoops that we jump through to make that happen for a patient. So unfortunately, with our breast cancer patients who have Medicare, we end up directing them a lot to different types of solutions. Maybe we don't direct you to the highest form of compression that's super expensive. Maybe we get you going on some drugstore solutions. And to kind of continue that conversation, it also very much depends on what your supplementary insurance is. So let me say that. So if you have Medicare, and then you have a Medicare Advantage type plan that follows Medicare guidelines, unfortunately, those are usually denied. But if you have a supplementary plan that is kind of meant to take up whatever Medicare doesn't do and doesn't follow Medicare guidelines, typically that's an insurance that would cover those garments. And what we do in the clinic is we work with a third-party vendor who will then review all of your insurance information and find out what can happen and what type of benefits you do have. And then you come back to us, tell us what's going on, and if we have to figure out some other solutions that are more feasible, we are absolutely 100% equipped and able to do that. And to speak a little further too, as far as breast cancer, there are insurance coverages related to bras and prosthesis. So that is something I really encourage you to look into with your specific plan. I hope that answered the question.
Great, thank you. Does anyone else have another question? You can send it to me in a chat, or you can unmute yourself and ask. I have one more. I have been asked to ask you if they're noticing some of these things happen, what steps should they take next to go see a doctor and get referred over to you guys?
Okay, well, that's an excellent question. Usually you want to go to your primary or to your oncologist if you have a cancer history. If it's venous insufficiency, you're going to want to get a vascular referral, but typically it starts out with your primary. So you're going to go to your primary, you're going to talk to them, you're going to let them know what's going on. You're going to say, I'm getting some swelling in my ankles. It's not going away. I'm getting a little extra pain. I'm having a hard time just, basically moving around because my legs are so large. I can't get them into any shoes anymore. Whatever your symptoms are, you let your primary know, and they will go ahead and refer you out to the proper places. So basically, if it's lower extremity swelling and it's something that's coming on insidiously, sometimes they want to get you to get a vascular referral. So they want to make sure that there's nothing going on vascular with you. If it's someone with a cancer history, almost always the referral goes directly to their oncologist, and the oncologist then takes it upon them to go ahead and refer it to us. So there is a little bit of a hierarchy as far as how to get to us, but usually you want to talk to your primary. And sometimes if the primary doesn't know that we exist over at Eisenhower, you can say, hey, we exist over at Eisenhower. We're over at the Desert Orthopedic Building. It's the brand new construction over there, and I just saw a lecture online, and they were able to let me know that this place does exist. So and that way you can actually kind of get over to see us. If you have any questions about where we're located, you can always contact Eisenhower and ask for the lymphedema clinic or the Rinker clinic, and you will get to us.
Perfect. Bob had asked the questions, how do we set up consultations? But it seems like that also answered that. So specifically, they just want to ask, they want to reference your guys' clinic if their doctor is unaware, correct?
Yes. So if you really want the very specific verbiage on that, we are located in the Harry and Diane Rinker building here at Eisenhower, or Desert Orthopedic Center here at Eisenhower. You need to get to occupational therapy, lymphatic therapy. Okay. And so make sure that you want to make sure that the referral is articulating where the swelling is, what's happening, and that this person needs to be evaluated and treated for lymphedema.
Okay, perfect. So it looks like our time is up. Have all of our questions been answered, or did anyone want to ask anything before we wrap up? Everyone's good? All right. Thank you, everyone, for joining us today. Hope you have a great day. Stay safe, stay healthy, okay?
Can we wave to everyone really quick?
Sure, go for it.
Okay, I'm going to wave to everyone really quick. Hi, nice to see everyone. It's been a while. Hi. I'm going to switch out so Courtney can come in here and wave too, okay?
Hey guys, good to see you. Hi. Oh, thank you so much for coming, you guys. So appreciate you. Thank you.
Thanks, everyone. Have a great day.